So I just got out of my meeting with CPS and the doctors, and basically they said that if Jezreel doesn't start chemotherapy, that he has a chance that he will definitely pass away. And I said it very loud and clear, I'm not starting chemotherapy, and so whatever that looks like, it's scary, of course, because obviously my brain wants to give in, but there's no way. There's no way that they're telling me that this is the only way. He said that FDA doesn't mandate them. They don't mandate anything. And I can't sit here and say I know it all, but it doesn't sound right to me when I know that there are natural ways that he can be healed.
All right, so I stumbled across this lady on TikTok who unfortunately has a 4-year-old son who was diagnosed with acute lymphoblastic leukemia. And so this is actually the most common type of childhood cancer. And over these last few decades, we have fortunately seen overall long-term remission, cure rates for children. We've seen it greatly improve. Now we have about 85 to 90% of pediatric patients that are successfully cured. When you compare it to like the 60s, the cure rate for this type of leukemia was only about 10%. And so we have seen since then a steady increase in success rates, and this is largely attributed to standardized protocols that do include risk-adapted chemo, intrathecal chemo, and this is when the medication is actually delivered directly into the CSF, and that's either to treat leukemia in the central nervous system or even like prevent it from occurring, so they'll do it prophylactically. We have better supportive care like the use of antimicrobials. We have intensive care units that can take care of these patients. Even more recently, we have immunotherapies for patients that are considered higher risk or if they've experienced relapse. And so there's no doubt that this is an extremely intense therapy. And the harsh reality is that chemo attacks cells that grow and divide quickly. And so, yes, the cancer cells are attacked, but also the good cells, so to speak. And so we can see these side effects that chemo can damage, like bone marrow, the GI mucosa, hair follicles, reproductive cells. And because of this, there's just no denying that chemo causes harsh side effects. But even with all of these horrible side effects, the harsher reality is that oftentimes chemo is the only option in saving a person's life. And so that's the reality for this 4-year-old boy. He has a very aggressive cancer that will cause him to no longer be alive if he does not receive treatment. And as of now, our best treatment at this time is aggressive chemotherapy and intensive care.
Everyone who's giving me crap about the chemotherapy, I'm not saying that I don't want my son to do chemotherapy. When I'm saying that there are different options and different protocols that he could have because he's an early responder to the doses that he's already had, and it was only steroids. So if my son is responding so well to steroids and he doesn't really need the high toxic rates that they're giving him, then why give it to him? It makes no sense. They haven't gotten back all the bone marrow results. They haven't gotten every result for the mutations, the genetics, or anything. And so what I'm asking them is to skip a dose, reduce the dose, or let's go on the Blinko. It's another chemotherapy that they use that's immunotherapy. I'm not saying I don't want my son treated. I'm not saying that. But what I think is bullcrap, then in Florida, parents have no rights unless you have an attorney. But glory to God that I have a voice and it matters and I've gotten somewhere. But the point is, it's the thinking that people in America are stuck to, that chemotherapy is the only way. I'm not saying, hey, let's not do anything. I'm saying, can we meet somewhere? Meet me in the middle. No, we can't. Absolutely not. His survival rates. Okay, he has a 98% of surviving, but the way that his body is responding, he won't make it to the 6 or 8 months. So your 98% is literally bullcrap that's not going to allow my son to survive because it's too toxic for his body. And the thing is, if you're not willing to do a test that lets you know the toxicity within the body, then that tells me that you know that his body has a high toxic level. And if I can prove it, then automatically your little spiel, to be nice, it won't stand in no courtroom. It will not stand. And so my fight with DCF is not like, hey, you're forcing me to do chemo. No, it's you're forcing me to do chemo and not letting me get a second opinion on the medical protocol for the leukemia that he has. I have every right to seek a second opinion on the treatment that we're having. I signed to this treatment because they said there was no other way. And as a mom, if you told me there's no other way, there's no other way. But now researching and talking to other doctors, yes, there is other ways, different immunotherapies that he can do. There's another thing called CAR T. There's so many ways that he can be cured that is chemotherapy, just less toxic. I'm not asking them to find a I don't know, a prescription or something from a different country. No. If it's here in America, why can't I have the access to it? If it's going to cure the leukemia in my son and minimizing the toxicity rates. And then in the future, we talk about it. But give his little body a break from all this toxicity you're constantly putting in his body.
All right, so I have a few points to make about this video. One, the CAR T cell therapy that she's talking about. This is personalized immunotherapy. It's actually engineered by a patient's own T cells to recognize and kill cancer. And it is an incredible tool, no doubt, but it's high risk. It's very resource intensive, and we're still basically studying it. And so when you compare it to our standard of care, it's just not used as often. It's typically reserved for patients who either fail their initial therapy or if they experience relapse. And then also her repeated suggestion to like get a second opinion, maybe skip a dose, ultimately delay treatment. It's not realistic, and it really could be very problematic for her son. Like I said, it's an aggressive cancer, and starting appropriate chemotherapy promptly, oftentimes within days of diagnosis, greatly improves chances of success. It reduces the risk of life-threatening complications that we can see with cancer too. And so this is why the state had to step in and remove her parental rights, at least for the time being, because the child's life is literally on the line and his quality of life. And every day that she pushed to delay care for him could ultimately contribute to his death from this cancer. And so I want to say I fully support asking questions, understanding options, understanding risk and benefit. But when you have pediatric oncologists that have dedicated their lives and careers to understanding cancer and treatment for this specific vulnerable population, and that they're telling you, hey, your child is going to die if we don't do prompt chemotherapy, that should be enough to give you pause on fighting their recommendations and just simply heed expert advice. Also, I read through some of the comments too, and one thing I saw the mother write, she responded to someone else and said that her first choice of treatment for her son is actually HHT. Like she's I don't know, shopping at a Walmart and she's going to pick that one up instead. She, I guess, thinks that one sounds best. And it is plant derived medication if you look it up. And so I feel like she just read that and immediately heard, natural. And I don't want to go down a natural tangent, but that constant push for natural is always better honestly drives me a bit crazy, because natural can be toxic too. Natural doesn't automatically mean that it is safe. But the issue here with her wanting this HHT treatment that she's talking about, it's not even approved for treating pediatric acute lymphoblastic leukemia. It's actually only approved for certain CML or chronic myeloid leukemia in adults. And so it's just a perfect example of, I did my own research, that trend that just goes way too far. There has to be a place for expertise. We as humans, every person can't possibly know everything all the time. And so having experts in specific fields like pediatric oncology is extremely important. And again, I do recognize that chemotherapy is not perfect, but as of now, it is a key component in the standard of care for acute lymphoblastic leukemia and, of course, many other cancers as well. And it is a major contributor to declining cancer death rates.
I have faith that God will heal my son without chemotherapy, and I don't know what to do. I don't know how to advocate, and I'm just so afraid now. Because I know that if they mandate me to start chemo, then I don't know. It's crazy out here. But nonetheless, I trust God above all. And all I can do is pray that they'll give me the chance to fight for my son the right way.
All right, so, of course, if you believe in God and his divine intervention, okay, which I will say I do struggle with this concept because, well, the sentiment is that you believe God intervenes, in your life, but not in so many other tragedies that happen worldwide, like genocide, starving children, other children with terminal or incurable cancers. And so I'll be completely honest, I find it pretty egotistical when people say that, God intervened in something and saved someone, answered their individual prayers, but just chooses not to respond to others. But my point here is that if you trust God, then why not consider that it's actually God putting these doctors in your child's life? Why not trust that modern medicine is a part of God's plan, Or better yet, I guess in this circumstance, I suppose God's plan then would have been that experts and professionals quickly identified that this mother, was literally putting her child in harm's way by delaying his cancer treatment because, quote, she said, doesn't sound right to her, or she knows there are natural ways to heal him. So maybe it was actually God's divine intervention, even though, again, I said I struggle with that. But I think it poses a larger question, too, here. Where do we draw the line when it comes to honoring a caregiver's wishes for a child's health care or treatments received? Because it is complicated. A competent adult, they can absolutely make their own healthcare choices, no questions asked. They can refuse treatment. All clinicians can do is educate on risks and benefits. It's 100% up to that, again, competent adult. But what about a child who may not understand risks and benefits? A child that cannot consent to treatment or consent to forego treatment? Does the parent or caregiver always have authority to consent to routine medical care for their minor children or, again, forego treatment? Usually, yes, but there are some exceptions and there is definitely some gray area. But I think it's an interesting discussion to have. I think an obvious topic would be when clinicians are treating a patient that needs life-saving interventions, a pediatric patient, waiting for parental consent, obviously, if it would delay care, is a no-brainer. But what about something like vaccines? I know that is a controversial topic in today's climate, but consider the MMR vaccine. It's highly effective at preventing measles, yet the number of parents choosing to not vaccinate their child with the MMR, it continues to climb. And so we see this play out in real time with these continued localized outbreaks. We see it in several countries, including the US, with the occasional lethal pediatric case, for example. And you still hear these parents come out and say after their child has died that they stand by their decision to not vaccinate their children. When does it become medical neglect? Where do we draw the line between personal beliefs and medical neglect? Anyways, I'm just so happy that the medical team, CPS, the ethics community, all of the above, stepped in for this child and intervened in his care so that he could get the chemo that he needs to save his life. Hopefully she didn't delay his care too much and he's able to make a full recovery and go on and live a full life. But can you imagine learning later on about this, that your mom tried to stop you from receiving life-saving chemo because essentially her vibes were off? How does one's relationship recover after that? I cannot even fathom the idea of it. Let me know what you guys think in the comments below. I'm curious to see what you guys have. I know it's a little bit controversial when you talk about caregivers and parents and their children and rights, but these children are also autonomous humans that deserve quality of life. And it's kind of scary that a parent can just choose based on their personal beliefs, even if it doesn't reflect what's best for the child. But yeah, let me know what you guys think. Until next time, I will talk to you guys very soon. Hopefully you are enjoying this beautiful weather. It is so warm here in Michigan. It's wonderful. We have thunderstorms coming though, so I actually love a good thunderstorm though. Anyway, I will talk to you guys very soon. Wishing you all the best. Bye, guys.